One of the hallmarks of our movement is the leadership of physicians, and in particular, the leadership of the Physicians for a National Health Program. Our next speaker is Claudia Fegan. She is a past president of PNHP and has been actively speaking in support of and working for HR 676 and single payer for many years. Claudia has served more than 20 years as a practicing physician and is currently the Associate Chief Medical Officer of Ambulatory Services for the Cook County Bureau of Health Services in Chicago, Illinois. Please welcome Dr. Claudia Fegan.
Thank you. As we're sitting here tonight, there are 45.7 million uninsured people in the United States. And there are probably some 50 million people who are underinsured, meaning that even though they have health insurance, they cannot afford the care they need. While it is true that we saw a slight decrease in the number of uninsured last year, this was due to a massive expansion of public programs. Were it not for the fact that 2.7 million more people were covered by public programs last year, Medicaid, S-CHIP, and Medicare, we actually would have seen an increase in the number of uninsured. So it is clear that national public health insurance is no longer the best option. No longer the best option to cover all Americans. It is the only option. The private insurance industry is never going to get us universal health care. We live in the richest, most powerful country in the world. How long are we going to let this go on? 2 months ago, I admitted a woman to the hospital. Both breasts were rock hard, filled with cancer. The skin was discolored and dimpled. Her armpits were filled with swollen lymph nodes. How could this happen? She had no health insurance. She was a hairdresser. She was sitting at home waiting to die. She thought she had no other choice. Her daughter brought her to us and asked us to help. How long are we going to let this go on? The insurance industry profiteers by retroactively denying coverage to people with illnesses. Insurance companies gladly take money from people when they are well, promising to take care of them should they need it. Then, when they are sick, the industry systematically finds ways to deny them health care they need. How long? How long are we going to let this go on? The United States pharmaceutical industry today is more profitable than the gaming industry. I'm talking about people who throw money on the table and they scrape it away. The American public pays the highest prices in the world for pharmaceuticals, while the same companies sell the same medications all over the world for prices 1/2, 1/3, and sometimes even 1/10 the price of what they charge in the U.S. How long are we going to let this go on? People are losing their jobs because they can't get care and can't work as a result. They are having strokes and heart attacks because they cannot afford the medication to control their blood pressure. They are having limbs amputated and winding up on dialysis because they cannot afford the medication to control their diabetes. People are dying because they can't get the care they need. The insured and uninsured are having care delayed or denied because we do not have a health care system. Our county health care system in Chicago is so overwhelmed it takes months to get an appointment. There's no system in this country other than to deny care to those who need it. Access to care is a profit center controlled by the insurance industry. We pay them to limit access to care. We spend more than $7,000 a person on health care in this country, in the United States, and yet we are ranked only 36th in the world by the World Health Organization for the care that we deliver. How long? Our infant mortality rates are higher than other nations. Our maternal mortality rates are higher. Women die in childbirth in the United States at higher rates than other industrialized nations. 9 women for every 100,000 live births. In Germany, the rate is 3. In Sweden, it is 4. In Canada, it's 4.6. I'm not talking about a third world country here. I'm talking about the most powerful nation in the world. The only country in the Western Hemisphere with a worse childhood immunization rate than the United States is Haiti. And they're getting better with our help. How long? We spend enough money on health care in this country. We just let too many people who aren't involved in providing care take profit from it. The United States no longer guarantees access to care for all veterans. 12% of non-elderly veterans in this country are uninsured. That means if you go out and lay your life on the line for this country, even for a war you don't believe in, and you survive and come home, you are no longer guaranteed access to care when you leave service. So when your post-traumatic stress disorder is diagnosed 2 to 3 months after you return, you're not covered. How long? This is about justice. Health care should be a right to which everyone is entitled. Remember, we live in the wealthiest country in the world. We spend more on health care than any other country. It is time we got our money's worth. It is time we got the health care we deserve and not the health care the insurance industry is willing to let us have. It is time we made health care a right for all and not a privilege for those who can afford it. We will never get universal health care until we change the political climate in this country. That is our challenge. It is time for us to demand what we need. It is time for us to demand what we deserve. It is time for us to demand universal health care. We won't get it by urging the insurance industry to play nice with others. We will get it by demanding a single-payer national health insurance, Medicare for all. The idea that single-payer would take too long makes no sense. Medicare passed and was implemented in 1 year. The idea that we have to do something else while we wait for single-payer is like putting a Band-Aid on a problem. As a physician, I can tell you, Band-Aids are nice, but they don't solve the problem. We will get there by supporting Congressman Conyers, and we will get there by fighting for H.R. 676. Physicians for a National Health Program is an organization of 15,000 physicians. We are committed to fighting for this change. We are committed to helping Congressman Conyers get H.R. 676 through Congress. Polling data tells us that nearly 500,000 physicians support single payer. The California Nurses Association is committed to this H.R. 676. The co-sponsors here tonight are committed. And the next President of the United States, Barack Obama, has told us, yes, we can. So, we can answer the question, not much longer will we let this go on, because we are ready to fight for the health care that has everybody in and nobody out. Say it with me, everybody in and nobody out. Everybody in, nobody out. Thank you.